Ladies and gentlemen, we have with us a very special guest today. He is known to be the software surgeon, a renowned trainer, and a living legend of laparoscopic surgery.
He is the author of more than 60 international publications, and he has been working as head of the department of upper gastrointestinal surgery in GEM Hospital, Coimbatore, Tamil Nadu, India.
So, we are introducing to you Dr. R. Parthasarathi, sir. Sir.
How are you, sir?
Yeah, fine.
It's a pleasure
to meet you, sir.
Sir, we are working as a surgical trainee in Sylhet M, Osmani Medical College Hospital. So it is a very, overwhelming experience for us to have a meeting with you. Sitting, it's a pleasure. It's a great pleasure.
So we all know the journey was very hectic and very long, and as we are beginner in laparoscopy, we know that the work is very tiresome, and we have gone through more than 16 hours of surgery in the OT, and we have gone through tiresome lectures also. Other than this, how was your experience at Sylhet, our Sylhet, sir?
So, first, I am very happy to be here. And it took a long time to reach my place, Coimbatore. I have to come to Calcutta, then Dhaka, then Sylhet. It is a long journey. And I don't feel any tired after seeing you people. They're very good, affectionate people, good hospitality, and I'm very impressed. I don't feel like I'm in a different country. So that's what I say. I told in the last inauguration yesterday. So it is like I'm in my country only. Very, very affectionate people. And this is my second visit to Bangladesh. Last year I was in Chittagong Medical College. There is a conference. I did laparoscopic cancer surgery, gastrectomy, laparoscopic gastrectomy, live surgery, and it was witnessed by more than 700 surgeons. And they are so happy. And my passion is teaching the laparoscopy, taking the laparoscopy to the entire crowd. So once I do one surgery, live surgery, and then all my tiredness will go. That is the thing. And this is the way of routine work in my place. We used to start by 7 o'clock in the morning, and then till 7 o'clock I have to do all the regular clinical work. Then I do academic work like this, paper writing, and I was making a book. It will come in my chief name. 7 books so far written, and for about laparoscopic surgery and hernia surgery. We have a separate book, and there is a 3rd edition of hernia surgery released last week. So up to 9 o'clock or 9:30, I do those kind of work. So that's why I'm not getting tired working here.
You will be impressed to know that we almost had a journey of almost 16 hours, right? Among that time, he also did a by road journey from Dhaka to Sylhet. That is also 8 hours journey. Not only by the air, that takes only half an hour from one city to another city. But there is a time that he had to take the by road journey. So
actually, we planned 3 days conference. If I buy from Dhaka to Sylhet by air, I have to stay in the Dhaka overnight, and then only the afternoon flight I could reach only in the 2:30 to 3 p.m.
Yes.
So already we committed to Friday morning start the session, so that I don't want to postpone the session. So we traveled by road. In the night we started around 10:30 in the Dhaka airport, and then we reached here by 4:45 a.m. It was 5 a.m. in the morning, and then we start our work from 9:30.
This shows his devotion to teach and devotion to train the new beginner of the laparoscopic surgery field. This shows how much devoted he is in this field.
Sir, it will be a great pleasure if we give us some glimpse of your childhood. We want to know about childhood. How you
actually, I was come with a very ordinary background, and in my family, I am only the educated person. I have one sister and three younger brothers. And in those days, it's very poverty, and I have to work for food. That is the situation. If I go work to some shops, then I'll have food on that day, like that. And then on the 6th standard, I was studied in a corporation school, not a private or any school. In the age when I studied 6th standard, it was so that time very poor, the family situation is so bad. So I was discontinued my school, and then I went to shop to work. Almost if you name any shop, petty shop, and then any shop, I work. So if I go to the morning, then I'll get some money to take food in the night. There's only one time food. Only night we take food, and then next day night only another food. The whole day no food like. That was the situation. And then one teacher came from school after 6 months of discontinuing my 6th standard, and then she came to my house, and then he talked to my parents, and then again I rejoined, and I continued that school till 8th standard. Then I went to the government school, higher secondary school. I completed my 12th standard studies in a government school. Then I wrote that is the first time the NEET exam, centralized exam selection for engineering and medical came. I was the first batch. I completed my 12th standard in 1988, and then was Tamil Nadu government is announcing the NEET exam, entrance exam, and then I applied for that exam, and then I got a good mark, and then they selected a my MBBS in the medical college, Coimbatore Medical College. That is CMC one, like Chittagong CMC, Coimbatore Medical College, and it was my name came in the paper, number, everything. And then my father told me that it is very difficult to study as doctor, and we have that much money. Don't want to make doctor. Go join some arts college, have a basic degree, some bachelor degree. That is enough for our future. Then what I did, I joined BSc chemistry, and I didn't go for a medical college. They allotted around 15 days time to joining date from this date to this date, and all other neighbors all are poor. It's like a daily wages, like they go in the work in the morning, they come in the night. And then everybody is told to my father, he studied well and then got a good mark, and then why are you not joined to the medical field, MBBS? And then one day finally somebody gave money to my father. It is only 2,000 Indian rupees. And then I went last day of joining day came, and then myself and my father went to Coimbatore Medical College. I was not in Coimbatore that time. It is around 70 kilometers away from Coimbatore. And then I went to Coimbatore, and I was when we going the bus, I was a little worried about if it is a 2,500 rupees fees, I couldn't join. That worry is in my mind. And then finally what happened? 500 rupees, only 650 rupees. 500 rupees demand draft, and then 150 rupees pay. 650 rupees I joined medical college. MBBS. And then I didn't buy any books in my first year. Only final year when I come, I bought a books. Until 4 years I studied with the library book and then my colleagues book. So such a difficult thing in my UG life. Then after that, slowly things changed.
This is a really inspiring story indeed.
No, it is when I completed my studies, I thought if I don't have any background, I want to get name.
Yeah.
What name? This came my UG period. So if I tell anybody told my name, Parthasarathi, all surgeons would know my name. That is my wish. That is my wish. Then I do okay. I think myself, if you no background, no support from relatives, nobody support, and if you work hard, then you will be in a good position in one day. So that was I decided, and then I started working. I don't go for any tour, no cinema, no other entertainment. Only working. And anyway, I am very happy now. and a lot of trainees.
That's why you are
so many people, so many surgeons trained under me. And then if I go any part of India, some doctors, those who got trained with me, and it's there, they will receive me, and they are doing very good work. I put a lot of phone calls, and even from senior surgeon. And so I want to take biopsy from iliac nodes. What is the patient position? Where to put ports? So many, I have situs inversus lap coli, and then where to keep monitor, where to place. So many questions almost every day. So it is like very happy nowadays.
Sir, it was
very
inspiring
and interesting also for us also. Sir, we have heard about your personal life, childhood, and why have you become a laparoscopic surgeon?
Yeah, that is because of Professor Palnivelu, and he was also in Coimbatore Medical College. That time he is associate professor, and both is same unit. Both of us in same unit, and he was. I was seeing the first time laparoscopic surgery in the government hospital. He did one workshop in 1994, I think. Yeah, 4. Not 1994 end or 5 beginning. 1995 beginning. That time I was very impressed about the way he operated, and then he showed appendix, gallbladder, and hernia. Even those days, I was very impressed. And then after my studies, I joined him, and I started learning laparoscopy. And almost now I can say it is 23 years completed of my laparoscopic life.
Sir, the level of skill that you achieve in laparoscopic field, I think you don't need to open any case.
No, yeah, it is very less. Open surgery, I can say it's only few percentage, 3-4% cases open. And I'm doing upper GI work more now, and more of thoracoscopic esophageectomy, Ivor Lewis and McKeon's, and laparoscopically. So I don't, even for esophageectomy cancer, I don't open the chest or abdomen. I can able to finish laparoscopically. That thing I learned from Dr. Palnivelu. His technique is followed by entire world. And then even I saw the live surgeries of esophagus, and last year in Coimbatore. And this year I was invited for Spain. That was attended by one Spanish surgeon. And then his Spanish society, Upper GI Society, is organizing a conference in Madrid. So I was invited to Madrid in this month, June 8th.
That's a great news, sir. Very few attain such kind of skill. So do you nowadays prefer only suturing?
Yeah, particularly if we take hernia, suturing is our preference in GEM hospital. Not only me, entire surgery in GEM hospital, we do suturing more.
But
most of the surgeons in GEM, they learn from me the suturing. And I used to teach in the endotrainer and then during surgery also. And in 2005, nowadays, almost all over the world I travel for the conferences. In 2005, there is a ELSA meet, that is the Endoscopic Laparoscopic Society of Asia. That is Asia level congress. And then my chief, Dr. Palnivelu, did esophagus live surgery, was assisted by me. And that time there is a competition in one of the stall. And then they allotted 3 minutes time. And then how many, take one bite and then make knot, multiple knot. How many knots we are making in 3 minutes time. And there is a board, I went in the last day of the competition. And there is a board says that 18 knots maximum. Some surgeons 16, and one surgeon from Italy, I think he put 18, England 16, 13, 10, 8, or so many people. 29. And then I said, that lady was sitting, I said, I want to try this. He said, okay, try. Then that is a little difficult situation they created. I have to work like this. I was a little short, now I have to work like this. And then I aimed for 30 knots, and then I could able to do it 29. Because after this, that lady says 10 seconds more, 3 seconds more. It was created tension. So anyway, I could able to complete 29. I got a first prize in suturing competition. Question asked in many conferences, and we have done almost all kind of cancer surgeries laparoscopically, and Cesarean is otherwise called minimally invasive surgery. The small incision we are taking a big baby. So that's why it's no need for laparoscopy for cesarean.
Great answer, sir. Sir, nowadays a lot of medical students wants to be as surgeons and they have interest to become a surgeon in their future lives. What will be your advice for them for their student life to become
Few
a
words for
surgeon?
enthusiasm, few words for inspiring them.
See, once I tell no, once you become a surgeon, that means you have to face the difficulties. No, you don't expect within 5 years I will reach that maximum level. It's not possible. And minimum I can say around very less time is 10 years. Very less time. So 10 to 15 years time, then you can achieve your goal. It will take that much time. So you have to work hard. No other option. And particularly if you select the specialty like esophagus surgery or gastric surgery, it will take more time because I am upper GI surgeon. No, I know that how much difficulties in working in the chest. All important structures, heart, SVC, arch of aorta, esophagus vein, trachea, recurrent laryngeal. So everything will be all important structure. And then esophagus is the center of all these things. Without damage anything, we have to remove the esophagus along with the nodes. So like that, it is a very difficult one, and you have to aim one thing. And then you have to achieve all the time. You have to work hard to achieve that aim. So, my advice is, and then select some role model surgeons. And then select the field. Now itself. Suppose I want to be a colorectal surgeon. I want to be a hepatobiliary surgeon, only a pancreatic one. Or I want to be a transplant surgeon. Nowadays, a lot of opportunity for transplant. So like that, be like one thing and then work hard for minimum 10 years in that field. Then you will be considered as the best in that field.
So some tips and tricks for beginners in laparoscopy.
Sir, as a surgical trainee, what we should do if we have interest in that? What is
laparoscopy is the one, and I can say after laparoscopic surgery, the video workshop live surgeries is increased.
Yes.
When I was in UG that time, I could see the professor of surgery is associate professor is talking with the slides with only pictures.
Yes.
The picture is also not a good picture. So you can't identify the anatomy with that picture. And then the professor next talk is by professor means there is a slide, no slide projector. They put two screen slide projector. That is also only slides. The learning of surgery is very, very difficult those times. Because only if you assist the first assistant primarily, then you can see the deeper structure, pancreas, anastomosis. And then if you are a second assistant, you can't see the entire state. Third means only holding the retractor. Yes. So it is very difficult to learn. But laparoscopy is the one. Even staff nurse, anybody inside the operation theatre, they can watch the same thing. All our views are same. And the surgeon's view in open surgery, as a first assistant you can't get because you are seeing in the opposite side. But laparoscopy, everybody's view is same. So it is a very good way of learning is laparoscopy. Only thing, we have to see this surgery repeatedly, the unedited surgery repeatedly, and that is a good way of learning, I feel. You have to see the surgery. Suppose you was impressed in particular hernia or gallbladder surgery, see the surgery 4 times or 5 times, 10 times. Then each time it is like a book, a subsystem or something you are reading. And first time you can't pick up much point. Second time and third time you will see all the finer points you can able to pick it up. So the same way, if you are seeing the same video multiple times, and then you learn a lot. That's my idea of tips to learn laparoscopy is select the video and then see it many times. And then once you have performed surgery, record your surgery video and then see it. That is another good way of learning. Because during surgery, what is the mistake you did? You are not concentrating. You are concentrating in the surgery. You won't understand the small mistake. And if you record your surgery and then see it again, then play back and then see, then you will learn a lot.
As hand-eye coordination is very important in learning the general. What we can do to increase our hand-eye coordination?
It's only
is there any exercise or is there?
No, it's an endotrainer exercise. Hand-eye coordination is only with endotrainer.
So in one study I have seen in the internet that video games, playing video games.
Yeah, it is there. And video games and cell phone operating, and it will not be, because it is joystick like thing, and definitely it will be improved.
So can I ask, do you play video games?
No,
sir?
no.
Then how are you becoming
No time.
at level 2 saddle, sir?
So it is comes something if you aim something at, that is the question. And my chief used to tell, when he went to Africa for a trip, and in the jungle, and there is a zoo, all the tiger and lion, everything is there in the zoo.
Safari,
That, like not zoo, safari. And then that man asking chief, what is your speed of running? How much speed you run? And then he told 8 kilometers per hour speed in the treadmill, 8 kilometers. And then he shows, no, that is wrong. If I open the gate of tiger, then only I know your speed. You know your speed. You can run 20 kilometers. That much capacity you have. So once the difficulties comes, then we saw our potential. So that's why, and
yes, we get the idea, sir.
Yeah.
So it was a pleasure.
It is a lifetime achievement for me. So I have to admit, and thanks to Atif, his name is Atif. I am Dr. Anuj Karidas. He is Atif inside. It's really, I will admit that it's a lifetime achievement to take an interview of.
So I'm very happy, and talking to the students
so
always fun.
Pardon our. We have. I think you have to sleep. He has told that it's your.
No.
We have taken your time, sir.
And I welcome all of you for our hospital, GEM Hospital, Coimbatore, after completion of your studies.
Sir, any best wishes for Bangladeshi medical students?
Yeah, it is. I am very happy that, and I was in second time Bangladesh. I used to come again, and a lot of very affectionate people, I could say, very good hospitality, and then they are more fond of taking selfies, where frequent photos.
This is traditional, new trend.
And I wish all the medical students in Bangladesh, and then do well, study well, and then aim for how to be in future, and then set up a goal, and then work towards the goal. And thank you so much.